Bismillah ar-Rahman ar-Rahim. We're starting today talking about tremor. If you see tremor as a short case or long case, and you've been asked what are the type of tremor, there are 4 types of tremors. The first type is a fine tremor, just like this. It is seen in thyrotoxicosis, in elderly, in nervous person, in anxious person, in female usually, and sometime in an unfamiliar situation. You see fine tremor. Okay? This is a fine tremor. The second type of a tremor is a coarse tremor. It is flapping tremor, just like this, flapping tremor. And we define flapping tremor as a failure to maintain a tone, just like this. This is my hand, both my hand, with a normal tone. If the tone being failed to maintain, you get what? Flapping tremor, just like a bird. The causes of flapping tremor is an end organ failure, mainly respiratory and cardiac. It is a coarse tremor called the flapping tremor, and you should put the patient in this position and wait for at least 1, 2, and some people say 3 minutes to elicit 1 or 2 flapping tremor. Okay? The third tremor is what they call it resting tremor. Resting tremor usually occur in elderly, those with Parkinson's disease, just like this. There are 2 types of resting tremor. This one type is a counting money, just like that. And the second type of tremor is while he is holding a screw and he tried to screw something, a nail, seen in Parkinson's disease. And usually those patients, you get the glabellar tab is positive. Glabellar tab this way, you hitting the frontal part of the face, the forehead, and you get a blinking. Normally blinking is being stopped after 1, 2, probably the 3rd tab of the forehead. But in Parkinson's disease, he keep in and out, opening his eyes all the time, continuously. This is called what? Resting tremor. The 4th type of tremor is called a tremor on landing tremor. You see it in cerebellar tremor, intention tremor. You put something here and you ask the patient to do this way to take it up, to take it out, this piece of substance, just like this. They do get a tremor on flying. They fly normally, and they do get a tremor on landing. This is called the flapping tremor, indicating cerebellar disease. Cerebellar disease is a disease of the cerebellum, and one of the signs of cerebellar disease is what is intention tremor, not flapping tremor. An intention tremor. This is intention tremor. This is intention tremor. You get a tremor on landing, on taking some object, on doing something fine action of the hand. You get what? Intention tremor. Therefore, the tremor are 4 types: fine tremor, flapping tremor, and you get resting tremor in Parkinson's disease, and the 4th type is the intention tremor you get it in cerebellar disease, just like this. Thank you.